Good morning, everyone. We'll start today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, we are also joined by Dr. James Hildreth, President and CEO of Meharry Medical College, and Leslie Waller, epidemiologist with the Metro Public Health Department. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are with us to help answer your questions. We will now begin with Mayor John Cooper.
Thank you. Good morning, Nashville. Yesterday afternoon, Governor Bill Lee announced that the state's stay-at-home order will end on April the 30th. This announcement does exclude our state's major metro areas, including Nashville and Davidson County, and applies to 89 of our 95 counties. Now, we should remember that several features of Nashville make our reopening process different and important to get right. Our size and population density, our infection level, the number of businesses that operate here, transportation and commuter patterns in our county and region, and our global tourism industry all make Nashville's careful and safe reopening critical to the region. In many cases, Nashville's reopening requires consumer confidence. We have to earn that consumer confidence to reopen successfully. We have to have the trust of employees who know that everyone is working to keep them safe. Schools, healthcare, and hospitality, all huge parts of Nashville's economy, require a special level of confidence created by the implementation of effective social distancing techniques to have a successful restart. Now, Nashville's strategy will be centered on a data-driven reopening schedule while working in close cooperation with the state, local business leaders, and our public health experts. We continue working with the Tennessee Major Metro's Economic Restart Task Force on the timing and coordination of a 4-phase economic restart plan. And this is a plan we look forward to submitting this Thursday. Now, based on the latest COVID-19 data, we could see phase 1 of our economic reopening beginning in very early May if we meet the following requirements for reopening. A rate of transmission less than 1, meaning each individual does not infect more than one other person in Davidson County. A 14-day downward trend in new cases of COVID-19. Adequate testing and PPE capacity for our region, and a robust health infrastructure to conduct contact tracing investigations throughout our community. These goals, which Dr. Jahangir will discuss in more detail, have been agreed upon by public health experts and our health system partners as objective, data-driven criteria as part of our public health and economic strategy to start getting Nashvillians back to work and back to life as normal. A phased reopening process also prevents our area hospitals and healthcare providers from becoming overburdened in the event of a spike in cases. Remember, a balanced approach is essential in reopening our economy and cannot come at the cost of our hard-earned progress in flattening the curve of COVID-19. Your efforts will largely determine the end of the safer at home order. Please continue remaining at home whenever possible and wear face coverings when social distancing measures are difficult to maintain as you run your essential errands. Now let's work together to get the number of COVID-19 cases down throughout Davidson County and begin getting everyone back to work. Now this morning, I'm glad to welcome back Dr. James Hildreth, President and CEO of Meharry Medical College, who is joining us to provide us with his thoughts on the coronavirus and the criteria for lifting the stay-at-home order in Nashville, and our efforts as a community in fighting this disease. I also want to welcome Leslie Waller, epidemiologist with the Metro Public Health Department, who is here to present the Tuesday COVID-19 heat map update and talk specifically about our plan to work with community partners in addressing the increase in cases in Southeast Nashville. Hard data and medical expertise through public health best practices will drive our response in Southeast and throughout the city. But our relationships with our community partners will only enhance our efforts, and we are grateful for their work. And as always, I urge everyone to visit Metro's COVID-19 website and donate as you are able to the COVID-19 Response Fund, which has been created to provide needed relief, including assistance with rent and mortgage payments to Nashvillians during this difficult time. You can also visit the website to learn how to obtain direct financial, food, mental health, and social service assistance. I'll now turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest we have on COVID-19 in our city. We now have 1,936 confirmed cases in Davidson County, an increase of 33 in the last 24 hours. There are an additional 1,749 cases in the surrounding counties, bringing our total to 3,685 in the region. Unfortunately, yesterday we had 2 more individuals die because of this disease. A 68-year-old female and an 85-year-old male. Both had underlying medical conditions. My sincere sympathies go out to these individuals' families and friends. And now that brings our total death number in Nashville to 22. Of the confirmed Davidson County cases, 927 are currently active, while 987 residents have fully recovered and have been cleared. As the mayor said, the major Metro's Economic Task Force met yesterday to finalize the plans we will use to reopen. Data and science will drive the timing of when we reopen, and we hope that will be in early May. We are looking at several metrics to determine the timing of this plan. These metrics are transmission rate, the 14-day trend line, public health capacity, testing capacity, and PPE supply and hospital capacity. Here's how we look today. The transmission rate needs to be under 1. This means, on average, a person is transmitting the virus to just 1 person or less. As you may remember, on Thursday, the Vanderbilt model reported that the rate here in Nashville is currently under 1. Regarding the 14-day trend line, yesterday we reported an increase of new cases over the weekend. The increase will negatively impact the city's 14-day trend of new cases. And today's new numbers will help get the trend back in the right direction. Next, we have an increase of our public health capacity by expanding our contact tracing team. We have done this from 4 people at the beginning of this crisis to 42 people today. We will continue to add additional resources as needed to increase our contact tracing and have a quick turnaround. Now, in regarding to testing capacity, we're doing well. In fact, the entire month of March, 5,551 tests were conducted. Since then, we have already conducted more than 12,500 tests here in Nashville. As you can see, we have increased and will continue to increase our testing capacity. Now, as I mentioned, our PPE supply and hospital capacity are also an important metric. And I'm proud to say right now we're at an adequate level. But we'll continue to monitor this. In fact, this morning, according to the State Healthcare Resource Tracking System, or HERTS, in Middle Tennessee, we have 42% availability of hospital beds, 72% availability of ventilators, and have a stable supply of masks, gowns, and face shields. So today, we are doing well in some areas. However, we need to see improvements on our 14-day trend. Now, when this data is pointing in the right direction and shows that the virus is regressing, then we will enter phase 1 of the plan. In phase 1, we will begin to open retail and commercial businesses as well as restaurants. Now, this opening will be at a limited capacity, and all will have restrictions to ensure social distancing and other protocols in place for the safety of the customers and the employees. Furthermore, healthcare facilities will begin to perform elective outpatient procedures for a selected group of patients. The plan will have 3 additional phases. Each will begin only if the metrics we're evaluating show positive improvement over a 14-day span. And each will roll back restrictions and open more facilities such as gyms, entertainment and sporting venues, and personal hygiene businesses, as long as well as allow for incremental larger gatherings as we get back to our new normal. If at any point in the process the data shows that the virus is beginning to win the battle, we will slow down and not move on to the next phase. These circuit breakers are an important safety net to make sure that the virus stays under control as we open. We will be sharing more details of the plan, as the mayor noted, on Thursday. And also, I should highlight that we want your input as we finalize this plan. If you have any suggestions, please go to covid19.nashville.gov and click on the link to submit your thoughts. Yesterday, the 3 community assessment centers were open to assess and test our residents. 800 people were seen at our assessment sites and 771 were tested, all at no cost to the patient. I actually had the opportunity to go to the Nissan site yesterday morning, and they had already seen about 100 people in the first 2 hours with no wait time, and the process itself lasted about 10 minutes from assessment to testing to leaving the site. Now, I know some people have had questions about whether we should open more centers, especially after seeing the long lines of cars at other testing sites across the state over the weekend. I want to be very clear to Nashvillians. Nashvillians who need to be tested are getting tested, either at a local healthcare provider or at our community assessment centers. We opened our centers 22 days ago during a time when testing was hard to come by. So we opened the centers with a limited number of tests, and we had protocols in place to prioritize who gets the test. Protocols which were consistent with the testing occurring right here in our region. When we got more tests, we expanded the protocols so that we could provide the test to more people. Now, if you're worried that you have been infected or you're in close contact with someone who is infected, you will be tested. And again, all of this at no cost to you. The community assessment centers are working, and they are working well. And if demand increases, we will expand and possibly add more assessment sites. But right now, our community assessment system is working. If you think you're not feeling well, or you think you have the virus, or you're just worried, I urge you to seek medical attention. Feel free to call our assessment hotline at 615-862-7777. Medical professionals are standing by to answer your questions and will help determine if you need further assessment. The hotline is open 7 days a week from 7 a.m. to 7 p.m. They will advise you for the next steps. And finally, please continue to remain safe at home so we can hit our goals to begin opening our city in early May. Only go out for essential trips, like your weekly grocery shopping or to the pharmacy. If you must go out, practice social distancing, wear a face covering, and return home right away. And if you think you may have the virus, or you've been exposed to it, or you're worried, please call our hotline and get assessed. I understand that people are getting antsy and that this is getting old. We cannot risk people's lives in this process. While we are planning to get back to our new normal, we need you to remain vigilant. I'm grateful to you, and now I'd like to introduce Dr. James Hildreth, President and CEO of Meharry Medical College.
Good morning, Nashville. I need to make a point that has been made previously, but it bears repeating. Viruses do not simply disappear, and until and unless there's a vaccine for SARS-CoV-2 virus that causes COVID-19 disease, we're going to be dealing with this virus. That could be as short as a year, maybe as long as 2 years, as long as it takes to develop a vaccine. So as a scientist and physician, I am comforted. My anxiety is less because we have a mayor who has decided to make decisions based on science and data rather than dates. Viruses do not respect dates. They're relentless pathogens who, when they find a host, they infect them and move on to the next host. And that's exactly what this virus is going to do. So data and the science, as much as we know of it, should be guiding our decisions. So testing has increased in Nashville, and there appeared to be an increase in the percent of people testing positive that did not correlate with the percent increase in testing. That could have been an indication that the rate of infections in Nashville was increasing. That gives us some pause. You've heard that we're trying to get the basic reproductive number, which is the average number of people infected by the virus, to below 1. We'd like to get it as close to 0 as possible because that would mean the virus is being eliminated from our populations. Most individuals develop symptoms within 5 days, as you've heard. Almost everyone would develop symptoms within 14 days. And that is why you hear that number of 14 days, to give us time to have everyone who's infected manifest that, get them into care, or otherwise not be a threat of passing the virus on. We need to remember another thing, that a large number of people get infected who never develop symptoms. Yesterday, the health department in Los Angeles County in Los Angeles, which has reported 13,800 cases, announced that they used an antibody test developed by scientists at the University of Southern California to screen about 900 people. When they extrapolated the data, they found something truly extraordinary, that as many as 400,000 people may have been infected by the virus without realizing they had been infected. And apparently most of these individuals had no idea that they had COVID-19. Some of them developed upper respiratory symptoms, but they didn't realize they had COVID-19. These individuals could well have been passing the virus on to others, so Los Angeles County might be set for a huge surge in cases. I make this point to say, since we do not know who might have the virus, we have to move cautiously, and again, we have to let data guide us. The apparent large number of people who have the virus without knowledge of it is one of the most confounding factors in dealing with COVID-19. We have to account for that in our planning. It is one of the reasons that we, Nashvillians, must stay the course, stay at home, practice social distancing, do the hygienic things to keep us safe. An extension is necessary at this point just to make sure, as you've heard before, that the basic reproductive number is moving in the right direction. One of the things that's intriguing about the data from Los Angeles County is that the fatality rate of the virus might be less than we had expected if, in fact, hundreds of thousands of people had the virus without knowing that they did. The other thing that I'm excited about as a scientist and infectious disease specialist is if there are hundreds of thousands of people who've had the virus and eliminated it from their system, their immune systems obviously worked efficiently and effectively. So we should take those individuals, do research on how they responded to the virus, and let that guide us in developing a vaccine. And that way, the immune system of the folks who get the vaccine can reproduce what happened in those individuals who cleared the virus, giving us a head start on what an effective vaccine would look like. So I'm really excited about that. But to be reminded, we need to stay at home, wash our hands frequently, protect our T-zones, cover our face when we're out. We've got this, Nashville. I think we've got the virus on the run, but let's make sure that we do by staying at home and protecting each other. So thank you, and with that, I'd like to introduce Ms. Leslie Waller, who's the epidemiologist from the Public Health Department.
Thank you, Dr. Hildreth. Good morning, everyone. Today I've been asked to briefly discuss the changing distribution of our cases across the county and how our team is responding to it. I wanted to start by describing disease surveillance just a little bit. This is a large part of any public health program or response. We collect information that includes basic demographics, where cases live and work, signs and symptoms of disease, and, of course, contact tracing. Over the last few weeks, the data we've collected have shown that cases in Nashville have shifted geographically, and most of our new cases are now clustered in the southeastern part of the county. The communities that call this area home are numerous and diverse. Our fellow Nashvillians who make up these communities also work in a number of essential service jobs, from healthcare to vital roles within the U.S. food system. Many of our immigrant and refugee neighbors have been putting themselves on the front lines of the COVID response, while many of us have had the advantage to work from home. To best serve and support these disproportionately impacted residents, we've partnered with the Tennessee Immigrant and Refugee Rights Coalition, also known as TIRC. Together, we will identify key leaders in our immigrant communities who will work as integral members of our response team. The health department will hire 6 to 8 community outreach workers from within our largest immigrant and refugee communities. Their roles will include sharing critical information and education, identifying and reducing barriers to testing, diagnosis, and quarantine, and providing case management to individuals who contract COVID. This program models other successful immigrant outreach programs currently being used by the city. This is an arm of the health department's operations that we're all really excited to begin. And I think I speak for many when I say I'm especially thankful to Turk for the incredible leadership and guidance throughout the development of this outreach program. The health department's goal is to keep all of our communities engaged and prepared as everybody learns to navigate COVID. And we're excited to have such valuable partners by our side. Thank you.
Thank you, Ms. Waller. Thank you, Dr. Hildreth. We will now start the Q&A segment of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Tosin Fakile at News 4. Tosin.
Good morning. Thank you for taking my question. I had a couple. I know the mayor said he was going to announce an extension, so I know we've talked about reopening. What exactly would be this extension date? And talking about the phases of opening, in the plans, are there ways that you guys are ensuring these businesses follow whatever guidelines they are? And if they aren't, are there like fines or penalties just to make sure they keep in track with what's being done? And my final question is for the epidemiologist. So now that we're seeing this cluster in a certain way, and we're seeing it has to do with people in the service industry, does that mean like our grocery stores and things, businesses of that nature are getting more, contacting the coronavirus? And if so, like how does that get sorted out is my question.
Dr. Jungir.
Thank you, Tosin. The order will be extended to May 1 in the next few days, and then subsequent to that will be data-driven. So that order will come out soon. Regarding how, as we move through the phases, how enforcement will occur, it'll occur just as it has under the Safer at Home order. Public health, working in partnership with the police and others, there's been an enforcement modality that has been in place that we've described previously, and I suspect that's exactly how we'll continue moving forth. And I'll defer to Ms. Waller to answer the next part of your question.
Sure. So like I mentioned, we've seen cases in a variety of essential service roles and industries, and we're currently working with a variety of business partners and community groups to make sure that we have certain policies in place as we start to reopen the city and mitigate the spread of COVID.
Harriet Wallace, Fox 17. Go ahead, Harriet.
Yes, good morning. My question is, I know that it looks like we're extending a little bit and going to evaluate day to day. That may not be the case for our neighboring cities. So I'd like either the mayor or Dr. Jahangir to speak to, or even Dr. Hildreth, concerns that maybe if some other cities are open, movement between the different counties and how we can try and control the viral outbreak. And then also from a business perspective, we found that some people are going to neighboring counties for business because we're not open here, how we plan to handle that issue as well. Thank you.
So the question is about travelers and commuters. Dr. Jungir.
Harriet, thank you so much. Listen, I agree with you that that's a concern. I think part of the reason what we are doing here in Nashville is to look at the data, and as we move forward, as let's say the governor's plan, the state opens up more initially than us, I think we need to continue looking at data, and I hope that our state leaders will also look to make sure that the data shows if there's negative trends that are occurring because of perhaps different levels of availability across our region. I think that's something we need to track. But again, let the data drive our decisions and not necessarily a date. Thank you.
Nancy Amons. Go ahead, Nancy.
Hi, thank you. First of all, when Davidson County residents go to other counties to get tested, do those numbers show up in the Nashville numbers? And also, I would love to hear Dr. Hildreth talk more about, I think he said he thought the rate of infection could be increasing. I'm not quite sure if he could expand that, and it would be great. Thank you.
Dr. Jungir.
Sure. So, yes, Nancy, to answer your first question is, your positive results are reported to the county of your residence. So if whether you're in another county or you're in Tampa, we've had a result once from Tampa I saw. If you live in Nashville, your report of your positive comes to the local health department. So all Nashvillians by residence will get the answer. And Dr. Hildreth and I were just chatting. What he was referencing was what we call the positive rate. So of the tests conducted in Nashville, of all the tests, nearly 18,200 tests, if I remember that number right, 10.7% of those cases are turning out positive, where last week that was about 10% or 9.9% of total tests returning positive. And that's, as we mentioned yesterday and over the weekend, that's why you saw that spike in incidence of nearly 300 from Friday to yesterday. And that's why, again, we're very vigilant about watching that data, and that's why we brought it to your attention as a community yesterday. But our hope is that how many number of people get positive goes down and down as more testing continues as we beat this virus.
Peter White with the Tribune.
This question is for Ms. Waller or Dr. Hildreth. It's sort of related to what Dr. Hanger just said. Is there a hard number, or it's about surveillance testing? How much do you actually have to do before you can extrapolate the numbers, have confidence in the infection rate of a given population? In other words, it sounds like we're kind of just going from day to day, but don't you have to sort of know what's going on over a longer period of time to have confidence? Oh, my second question is, what does Dr. Hildreth think? Is there going to be a second wave of this epidemic?
Thank you, Mr. White. Dr. Hildreth.
Whether or not there is a second wave depends on how well we handle this first wave. That's the main point, that if we stick this out to the end, it will be the end and not the beginning of another cycle. That's why we're doing what we're doing. And so, again, Nashville, if we are faithful and staying at home, social distancing, hygienic, all those things, we won't have a second wave. But the reality is, the virus is motile because people carry it with them, and they're crossing county lines and city lines. And that's why the surveillance that you've heard about is so very important, that if we can identify the positive cases and suppress the spread of those viruses from those positive cases, we can keep this thing under control. And so whether or not there's a second wave depends on how well we handle this first wave. So I'm pleading with all of us to stick with it to the end, so it will be the end of this wave.
Mr. White, I'll follow up with you via email to get clarification on the first part of your question. Stephen Elliott.
Hey, thank you. This is sort of a follow-up to Harriet's question. Dr. Jahangir frequently mentions the number of cases in surrounding counties. Do you think it's a problem that your strategy for reopening is not tied to theirs?
Thank you. Dr. Jahangir.
So I think, listen, Nashville is a very a great city that has a great region around us, and I hope that as we, along with our major metros colleagues, put out a plan, that our regional mayors will perhaps follow suit as well as possible, because as they did on their Safer Home order, that's when we started winning this battle against this virus. When we had our safer order and our colleagues in our regional cities implemented a similar safer order, that's when we saw the trend change. So, of course, what others do in our region makes a difference. We can do what the data shows us and the science shows us, and we will continue to do that. And to answer Mr. White's question, so you don't have to follow up with an email, that's why we look at the 14-day trend, Mr. White, and as to are we making a dent, is that's why the 14-day period matters so much. So there you go. So thank you.
Ian Jung at the Tennessean.
Hi, good morning. I have about 3 questions. I wanted to start with regarding the numbers in Southeast. Can you share any racial data on that? Do we have data that supports that these cases are immigrants who are essential workers, or are you assuming that the population, because it's higher in immigrant communities? Just hoping to get some more details on that. And then as we talk about asymptomatic patients during this briefing and how they've led to cases in other cities or states, does that indicate the need for Nashville to expand that testing criteria, especially as we prepare for a phased reopening? I'm just not sure if we're going to ask for any sort of clearance for a certain type of people going back to work. And then lastly, the White House had released some criteria for reopening economies, including a 14-day, downward trajectory. And I know Dr. Jahangar mentioned the 14-day trend here. I was curious if that's the benchmark we are using, and if so, today is kind of day one after the weekend number.
We'll start with Dr. Jungir.
And I'm sorry if I missed part of this, the reception was a little hard here. So let me get to one of your questions. Anyone that feels they need a test and who lives in Davidson County can come to our assessment centers and they will get a test. I just want to be very clear about that. I think it is important that you use our system and get medical attention if you're concerned or have questions by calling our hotline, 862-7777. I think if you have symptoms of cough, fever, shortness of breath, new onset loss of smell, or new onset unexplained diarrhea, you should have some worry that you have COVID and get a test. I think if you've been exposed to someone, you should have some concern and come get a test. I think just showing up at a testing center to get a test, if you feel like you need a test, we'll get you a test, but there are potential risks to yourself by going to an area where there's probably a higher level of people who are positive with COVID. So I just want to be very clear on that, and it's free. So number one. Regarding your question about racial and ethnic demographics, I apologize, I'm bringing my phone up. We'll provide you a more detailed update tomorrow, I believe, but to kind of give you an idea, currently 4% of the people testing positive are Asian, 12% are African American, 11 are other race or multiracial, 25% are pending, and about 40% are white. And so we're keeping a close eye on that. Well, I'm sorry, was there a third part of the question? I'm not. 14-day benchmark. What about the 14-day? Oh, okay. So I'm sorry, I understand. So here's the thing. This is not an easy science, right? As the mayor said, and as Dr. Hilder said, this is not a simple up-down. This is like flying an airplane, okay? And when you fly an airplane, you have a lot of metrics that you're looking at, a lot of dashboards and things. And so you'll fly your plane looking at all of these metrics. So our metrics, 14-day downtrend, the infective rate, the transmission rate, our supply of PPE, our testing capacity, our public health infrastructure capacity. We're going to look at all those metrics, and if they're all green, it's an easy decision to fly. But sometimes when you fly a plane, there's going to be some judgment calls, and you're going to need somebody who has a skilled pilot. And in our case, we have an amazing team of public health experts who will guide this decision to continue flying the plane or keep moving through our phases, or do we need to land the plane and maybe slow down on where we're at? So it's not just one metric. 14-day downtrend is an important one because, as Dr. Hilder said, that's how long this virus typically lasts and manifests. But all these other metrics I mentioned, hospital capacity, PPE, testing capacity, public health infrastructure, we're going to be looking at all that and let the data drive our decision moving forward. So thank you.
Kara Hartnett.
Thanks for taking my questions. Mine's for Dr. Hildreth. There's been lots of talk about having a data-driven approach to reopening this morning, and I was just wondering if you think the state has enough data to begin reopening the rest of the counties, and will the opening of those counties around us have a negative effect on Metro's mitigation efforts?
Dr. Hildreth.
I'm not privy to what data in totality the governor's team used to make their decision. What I am privy to is the data that we have here in Davidson County, and the fact that, as you've heard, we have a team of public health experts, including myself. We're looking at this very carefully. And what this comes down to is we have no control over where people move. They move between counties, they move between cities. They're the vectors for the virus, as you know. What we can do to protect ourselves is to have a surveillance system set up so that we can quickly identify positives, trace their contacts, and keep the virus from becoming an outbreak. That's all anyone can do, and that needs to be done based on data. The other reason why that's important is because we have limited resources. When limited resources are what you deal with, you got to make sure you're deploying them where they're most needed. You can't do that without a surveillance system and without testing and screening. So that is what we're trying to do, and we have no control over the other, well, I have no control over the decisions that are being made by others, but I'm really pleased to be part of a team where it really is science and data that's driving the decisions, and that's going to mean that the decisions we make are be informed decisions, and they'll be the best possible decisions we can make. But this comes down to one simple thing, making sure that we protect ourselves, and by doing that, we protect the whole community. Not to sound like a broken record, if we stay home, wear face coverings, protect the T-zone, wash our hands, clean the high-touch surfaces, we can keep the virus under control. But that is what I mean by using data to drive decisions, and that's what the testing is so important. I do applaud the governor for deciding that anyone in the state who wants to be tested can be tested, because that's going to make it easier for us to know where the enemy is. You've heard this referred to as the invisible enemy. How do you make the invisible enemy visible? You test, 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 and that's what we're doing.
Thank you again to Dr. James Hildreth, President and CEO of Meharry Medical College, and Leslie Waller, epidemiologist with the Metro Public Health Department, for joining us this morning. There are no more media questions in the WebEx queue at this time. A recording of this press briefing will be made available later this afternoon. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation,